Hi, I'm Katie, and this is Pieter, and together we own Mondo Sports Therapy in Austin, Texas. We are an outpatient orthopedic physical therapy clinic. We've been in operation for 5 years, and our specialization is treating endurance athletes, or as we like to say, repetitive micro-trauma.
So the thing with physical therapy clinics is that they're by and large, they're very good in treating macro trauma. So contact injuries, like you go skiing, you break your leg, or you tear your ACL, or you play football and you break a leg. Those are relatively easy to fix. What we're trying to do is fix the athlete that comes in with what we call repeated micro trauma. So wear and tear over time. Like in, for example, a runner that runs about 50 miles a week, has no problems, but all of a sudden he goes for an easy run and his calf muscle seizes up. And no clue what in the world happened. And the thing is, you run 50 miles with both legs, not just with the one leg that got injured, right? So our job is to figure out why is it that the one leg gave out, but not the other leg under the same amount of miles, right? And that is where the fun part comes in for us. The background knowledge that is involved with that is significant. We rely on the latest, greatest research. Katie and I have both taught at a graduate or we're still teaching at a graduate and a postgraduate level. So we incorporate all that we teach nationwide in our daily practice here in the clinic.
First and foremost, our main goal every single day when we walk into the clinic is to figure out how to get you back to doing the activity that you want to get back to. We are not just cheerleaders. Our job is to figure out why did that particular area become a problem to you and how can we help you get back to performing the activity that you love. If you are a runner, a jumper, a swimmer, a basketball player, whatever your sport of choice is, when you are not able to participate in your sport, we know that that is very challenging. And so what we will focus our entire education dedication to is trying to figure out how can we get you back to playing and back to exercising the level you need to go.
All our therapists here at Mondo Sports Therapy are fellowship trained in manual therapy, which is a 3-year postdoctorate subspecialization program in orthopedic physical therapy. So they have a significant
We've gone to school for a long time.
Yeah, boy, oh boy. So they all have a significant wealth of knowledge in treating this particular type of injuries, and we use a wide variety of treatment techniques. It's not just, we're not just one-trick ponies. We use joint mobilizations, soft tissue mobilizations, tissue-specific exercises, right? So because tendons are treated differently than cartilage, and they're treated differently than muscles. We work sport-specific very well. And so we make sure that you get the treatment that is appropriate for your particular case. There's no cookie cutter.
We do not use flow sheets. Nope. We do not use exercise protocols unless we're following a specific surgeon's post-operative protocol. But by and large, it is every individual patient that we see gets their individual program to match their individual activity level. Yeah,
it's tailor-made to you, your particular problem, and your particular goals that you would like to get back to, because we treat Olympic level athletes, but we also treat people that do a couch to 5K and want to get back to some form of activity. For us, it's all the same. We think it's all fun, and as much as we can bring you back to your desired level of function makes us happy.
Our goal with starting this vlog, with starting this YouTube channel, is to share our corrective exercises with you to help you get motivated to get back to exercising. If there's an area of your body that you don't quite like as much, or you want to be a little bit stronger and you don't know what to do, we're posting our videos that we issue to our patients to give you some inspiration, perhaps to give you a little bit more detail about the exercises, how to correctly perform them, and what muscle groups they're activating. I always love to say the human body is a fantastic thing. You can work on it at any age. So you may be 50, 60, 70 years old and feel like you've lost a little bit of muscle tone. That's called sarcopenia. But the great thing is if you challenge that muscle, if you load that muscle will adapt to the loads placed on it and it will get stronger. So our goal is to sort of empower you and give you some tools to do these exercises at home and to address any deficits that you have, to help to keep you healthy.
So don't let anybody tell you that you shouldn't do a particular activity anymore just because you're older, and now I'm talking about me, or if you have some arthritic changes in your body that you shouldn't run anymore. That is also not true, and we can help you out with that. So if you have any questions about that, by all means,
reach out to us and we will try to do our best to help guide you.
Yeah.
Let us know what topics you're interested in hearing more about. We would love to put any content out there that we have knowledge about. If it's above our pay grade, we won't answer it. We will make a recommendation. But we're always happy to help out where we can. Otherwise, subscribe to the channel, give us a like, and we hope to see you a lot more in the upcoming weeks.